Changes coming to the new center designed to give police a place to take people in crisis. We're talking about a place other than jail.
We have followed this project for years. It's named the Behavioral Health Urgent Care Center, but was long called the Safety Center. A mix of state and local funding made it a reality, but now that state funding is going away.
You're here at 6, WATE, 6 on your side. Reporter Madison Keevy joining us now in the studio. And Madison, talk first of all about the funding situation as well as the impact.
Sure. So last night, after the county's budget was approved, we got a clearer idea of how much money is going to be coming from local supports for this center. Now, county and city funding are two attempts to fill in the gaps left behind by funding of a state grant that only lasted a year, but it doesn't fully cover all of the same costs, and there are expected to be some changes to staffing.
The crisis provider, essentially, we're going to be there for people when they're in their most difficult place.
One of the goals of the Behavioral Health Urgent Care Center to provide mental health treatment and resources.
To identify adults in our community who committed low-level, nonviolent offenses, but have a substance use problem or a mental health condition, and they're going to be better served in a treatment facility than being incarcerated.
The center opened in 2018. In its first year, 75% of its funding came from a state grant through the Department of Mental Health. That grant only available for 1 year.
Really had almost a $3 million operating budget, and we will move to a $1.4 million operating budget, which necessitates some reduction in staff.
Jerry Wagner is the president and CEO of the Helen Ross McNabb Center. He says 85% of the center's budget is staffing. The loss of that state funding not only means cuts to staff, but that more money needed to come from the city and the county.
We work with Knoxville Police Department and Knoxville County Sheriff's Department to make sure that we're doing the kind of work they need us to do.
In this first year, the city and county provided operation funding of about $1 million. Now, the county will provide $840,000 and the city $560,000. Funding Wagner requested with patience in mind.
This past year, 74% of the people we cared for had no insurance. So we were able to care for them in a way that would not have been possible otherwise.
Healthcare within the county, a big discussion at last night's county commission meeting and over the last few months. And I'm told that because the Behavioral Health Urgent Care Center focuses on behavioral health care and not physical health care, it's not eligible for all of the options for county funding when it comes to health care. So something that they're kind of working through right now.
All right, we'll have to continue to watch that closely.
Yes.
Madison, thank you so very much. And meanwhile, we're going to be looking ahead to a meeting later in the month to see the plan going forward for handling budget cuts to a reimbursement program for local hospitals and medical care providers.
In that program, Knox County repays those organizations for some of the cost of caring for Knox County residents who have no other way to pay. Mayor Glenn Jacobs says the cuts to this program in his budget amount to around $1.5 million. One large provider, Cherokee Health Systems, says it stands to lose $540,000.
Cherokee CEO saying the group will make every effort to operate the indigent care program without modification. The meeting on this topic is set for June 24th. Of course, we'll keep following it. Meanwhile, we're talking to Mayor Jacobs about this issue and the rest of his budget Sunday at noon on Tennessee This Week.